over there. I don't know who's talking that name, but Mr. Yoder is here in the hospital. When you come into the hospital, depending on how sick you are or what your needs are, we place patients on a nasal cannula. It's very simple. Its capabilities are 1 through 6 liters, so we'll have it hooked to the oxygen back here, and this is a bubble humidifier. And depending on the patient, if they feel their nostrils are really dry, we put them on the humidifier for that humidity that our nose provides for us naturally. Okay, so what we would do is, he already has it on, come around, and we would have it hooked here to the oxygen. So essentially, it would be like this. Look like this, but it would be the green one, because this is for air. And I said its capabilities for a 1 through 6 liters. Any more than that, and it could burst, because that's what it's for. Just 1 through 6 liters. So if you put it at 8, which a lot of nurses sometimes will, if you work at a hospital and you'll see it yourself, this will like literally just get really big and make it explode. So capabilities of 1 through 6. All right, and this is for humidification. Yes, there we go. Humidification. Okay, that's the nasal cannula. Really simple. Just provides oxygen. Kind of like the first gear.
The next up would probably be the Ventura or the simple mask. It's 5 through 10 liters. It's usually really used for post-surgery. It's not as common as like the nasal cannula or anything like that. But yeah, so 5 to 10 liters, and you just put it over like this. It's like 35 to 50% oxygen. Yeah, and you want to make sure it's at least to 5 liters, because if it's lower than that, they could be rebreathing the carbon dioxide in their lungs. And you just hook it up like this, and turn it up to 5 to 10, depending on how much oxygen they need.
And that would be the simple mask. Next up, we have Venturi. Venturi mask. It's named after Mr. Venturi. I just remember his first name. But it's actually a really cool principle. It's also known as air entrainment. So you see a little port here? See? How it says like 6 liters and it has like the 50%, 40%. And you'll hear us talk about like percentages of oxygen. So essentially what you can do, this is a little bit old, but let's say someone says, or the doctor says, the order says, oh, 40%, you'd put it on 40%, so I'll go around. And then you see how it says 6 liters? Right there.
It's really useful for COPD patients because it's a fixed amount of oxygen.
So you would hook it up, correct, like we did, and then you would match the setting of the 6 liters at 40%. It's also really good for transport. That is the Venturi mask.
And you want to make sure this port is never covered as well. And then the last would be the non-rebreather mask. This one's really good if someone comes into the hospital with a lot of distress and need a lot of oxygen really quickly. So it's probably like 60 to 80% oxygen. And when you put it on the flow meter, you would want to flush it to where the bag doesn't collapse on inspiration. Yeah. Just put it on.
Bag will inflate, and that's how you know it's meeting your patient's needs.
Yeah, you want to make sure the bag's inflated.
Yeah.
Sure.
And those are our O2 devices, our simple O2 devices. We can take a volunteer, see if you want to hear some breath sounds.